cases grows, there's a new warning tonight.
Well, it is such a stressful time for all of us.
Anger erupted after a unanimous vote to make masks mandatory.
Trump tweeting again today.
Officials say the new virus was first detected in Wuhan.
Coronavirus cases are surging in Arizona.
Can spread person to person. Chinese authorities have traced a new deadly virus.
The governor says Arizona is on pause.
Never seen before coronavirus.
Already stressing the system.
Showing that we are right on the doorstep of the peak here for COVID-19 in Arizona.
President Trump acknowledging today the virus is not under control any place in the world.
That means the number of victims has doubled.
Anticipating additional positive cases, and we're not taking any chances.
Breaking news tonight, millions of Americans ordered to shelter in place as the coronavirus pandemic spreads.
So my name's Billy Harfash. I'm the host of Show Up Arizona that airs across the state of Arizona on iHeartRadio. And I like to say we have the people's microphone. We're the people's show. We're not right, we're not left, we're not Republican, we're not Democrat, we're for everybody. I get a chance to interview people from all across the spectrum, everyone from the governor, Martha McSally, mayors, and right now we're focused on the coronavirus and how it's affecting our great state.
In your opinion, what has the Arizona government's response to this pandemic been? Has it been a good response?
So when I think of the state of Arizona's response, I think of the face of the state, and that is Governor Ducey. I've had the chance to be at most of his press conferences. Heavy weighs the crown. So it's really easy right now to criticize. I think it's absolutely disgusting that this whole COVID-19 has become a political issue. This is public health. There's so many decisions that our leaders are making that affect our health, our wallets, our pocketbooks. I think he's actually done a pretty good job. It goes without saying whether you support the governor before this, whether you support the governor after this, I don't think it matters. I think what matters is that he's keeping the public safe and that at the end of the day, we still have our jobs. That's a tough task. I would not want to be sitting at his desk right now. It's very difficult, but I think he's done a pretty good job, all things considered.
In your opinion, has the president's decision to leave a lot of the key decision-making to the governors been a good decision?
Well, I'm glad you asked that because I think a lot of people might not understand that issue. It's a brilliant decision from a political standpoint, right? Because obviously, if certain governors make bad decisions, he doesn't have to own it. If certain governors make good decisions, well, he can own it, right? I empowered the governors. So politically speaking, I think it's probably brilliant. Now, when this all hit, and the people that I have on my team looking at this and the people that I've interviewed, I personally thought we need kind of a uniform approach. We need to put everything on hold. We need to stop all business, and he didn't do that. Everything is nuanced. In hindsight, I think it's a good idea to let governors, and maybe even more micro, let mayors decide what's best for towns, cities, villages. I think it's a good thing for governors to be in charge of their state, empower people, and at the end of the day, I think it's working for Arizona.
There are no plans to limit access to state buildings, including the legislature, as long as you're not sick. The affairs of state go on.
I think us in a public service have a job to do right now, and it's going to require all hands on deck.
My name is Alistair Adele, and I'm proud to be your Maricopa County attorney.
Specifically, what has your office been able to do to prepare for this pandemic?
We were able to shift our focus pretty rapidly. We have 1,000 employees in our office, and we needed to be able to pivot and protect our employees. We have about 70% of our workforce teleworking right now with the use of technology. We also have to still go into court though. Hearings are still happening. So we make sure we have a skeleton crew, we're using PPE, and we're sanitizing the office as much as we possibly can.
During this unprecedented time, what have been some sources of frustration for you in your job in dealing with this pandemic?
We've had a couple road bumps, if you will, I'm going to call them. It's definitely always a source of frustration when we can't get the proper equipment to our staff to be able to work remotely. That was frustrating, but also we're working with the courts. We are woefully inept on using technology, and it's forced us to look at that. So I'm really proud to say that we're looking at ways of being innovative now, and we wouldn't have had this but for the pandemic.
Some governors have declared states of emergency. However, Governor Doug Ducey says there is no need for that now.
There's different things that you can access, different resources.
Tests have been tough to come by in Arizona, and it's even harder for sheriff's offices across the state responsible for the thousands of men and women detained in county jails.
Well, my name is Sheriff Mark Lamb, and I am the 24th Sheriff of Pinal County. Interesting, our counties are huge here in Arizona. So our county is the size of the state of Connecticut, so very big. We have a little over 500 employees, but with our volunteers, we're over 650 employees.
In watching the COVID-19 situation unfold, how did you get your department ready for that, especially given that Pinal County has a detention center that houses hundreds and hundreds of inmates?
That's a great question. You know, we have very good people in place, and this was kind of an unknown. Like, we'd never really been through something like this. So we followed a lot of the CDC guidelines, the things that were coming out of from our federal government and also our state government. We worked a lot with our local health department to figure out what were the best protocols we could implement, and a lot of it was just common sense. But you're right, we had the jail, and so we were extremely concerned about making sure that we kept that out of the jail, especially when we didn't really know what the effects were going to be. And so we did the best that we could to staff our people with the proper equipment, but
our PPE shortage is not a funding problem. It is a national problem in the supply chain.
Monday, Maricopa County public health officials said the problem isn't going away.
In the end, we had what we had, and we made a lot of decisions, but a lot of it was just experience in the job and just doing what we thought was best and working with other people to make those right decisions.
How have you worked within your department to keep everybody updated on statistics and developments in this whole pandemic situation?
I might be a little bit different. You know, we've done a good job of keeping people updated, but I think that one of the issues that we've run into this country is information overload. And I think everybody is struggling with what's good information and what's bad information. We gave our people the best information that we thought we could give them. We didn't overload them with information. We looked at the numbers, we processed those numbers as it went along, and we gave adequate information. But I think a big thing is not panicking people. That's what we deal with in law enforcement all the time, is we have to take a situation and not assess it and not put people in a state of panic. And so I think that curbing that information, minimizing that information, but making it good information and well thought out and objective information was the best thing that we could do.
It's a massive stimulus package to stop the economic freefall. Millions more workers are expected to file for unemployment benefits this week.
The Paycheck Protection Program, or PPP, passed by Congress, was intended to offer financial relief to small businesses shuttered due to coronavirus.
Among the many empty small businesses across the country in dire straits.
My name is Dr. Michael Crockett. I practice dentistry in Mesa, Arizona. I also work with a nonprofit organization called Smiles, where we help women that have been abused through domestic violence and or been incarcerated, and help them transform their smiles.
As a dentist, you have to work up close and personal with your patients all day long. How have the COVID-19 pandemic restrictions affected you and your practice?
So I've been asked that a lot, and in dentistry we're told to follow very strict CDC and infection control guidelines. So in our day-to-day practice, we still utilize the same personal protective equipment. We're always protecting ourselves from any infectious disease that may come into our practice. The biggest concern with COVID-19 has just been a heightened fear with the team members, family, friends that know I'm going to work every day. But we're very well protected. I offer my patients and my team all the protective equipment that they may feel, so they feel comfortable at work.
I understand that you applied for a PPP loan. How was that process for you, and do you think it has helped?
I utilize one of the larger banks in the country, and there wasn't a whole lot of communication other than we've received your application and we'll be letting you know shortly whether or not you've been approved. However, I was not told anything until the day they ran out of funds that I was not approved.
The Federal CARES Act allocated $349 billion for the PPP and $10 billion for the EIDL loans. Thursday, both ran out of money.
During that period of time, I was told to use a small bank, and I said, no, I'm not going to go through a small bank. I've used this bank for 15 years. I'm sure they'll take good care of me and it'll all be taken care of. However, it wasn't. And then when I was denied or not accepted into the first round of funding, I was told there would be more funding, potentially, and that I would be next in line with this large bank to get my funds for my practice. However, I decided to contact a local bank here in Gilbert, and they were able to get me approved in about 45 minutes over the phone. And then when funds came available, the same day they were available, by about 3 o'clock that afternoon, I was already approved. I had a loan number, and I just received my funds like 2-3 days ago in my account. And I still have yet to hear anything from the large bank. No denial, no nothing. So that was my experience. Fortunately, it worked out for me, and it's definitely going to help my practice with bringing all my employees back and have them all come back to work, with the exception of a couple. But now I'm able to sustain the practice.
70% of small businesses had applied for help.
Dr. Anthony Fauci says the coronavirus is spreading and America may need to take drastic actions.
We're dealing with clearly an emerging infectious disease that has now reached outbreak proportions and likely pandemic proportions.
Well, hello. My name is Kevin Hartke. I'm the mayor of Chandler, Arizona. I've lived in Chandler for close to 35 years now, and it was one of the best moves that my wife and I ever made.
When you realized that the COVID-19 pandemic was on its way to Chandler, what were you and your office able to do to get ready?
Well, naturally, we've been tracking this for many, many months, long before when word first came out of China, and not really knowing what the impact was going to be, but as the spread started and this entered into the United States via Washington State, we started getting ready in the city of Chandler. We enacted our emergency operation plan. This gives us the opportunity to look at what crises could hit our community and what can we do about it. So after that, we also operated our Emergency Operations Center, which put to task a number of our directors and others that would start working on this and look for best practices around the country and see how we could apply them to Chandler.
Obviously, the pandemic has had a crippling effect on particularly small and mid-sized businesses. What is the city of Chandler doing to ensure the viability of those businesses moving forward?
Well, we've worked with our economic development staff to enact a number of policies and relief packages. I think first and foremost in Chandler, we've really wanted to pay attention to what we call our core businesses. A lot of those are more like our advanced manufacturing, advanced financial. A lot of the industries that have been hardest hit really have been small businesses related to hospitality. So whether it's hotels, whether it's restaurants, bars, really those are the ones that have been hardest hit. So we've still seen an uptick and holding our own related to construction. Our office, although things have shifted, the overall business has stayed intact, and our manufacturing, our Intels, our NXPs, our Microsoft, those types of companies have stayed strong with what they're doing, although they have changed practices. So what are some of the things that we have done for our small businesses is, first and foremost, we have done whatever we can do to get information to them. There's a lot of information out there, particularly related to funding from DC with the PPP, with the loan programs, and with similar but smaller packages with the state. So we tried to digest that. We've tried to get information out. We've worked certainly with the chamber and others to do the same. For our small businesses, we've also relaxed our sign codes. So we've been pretty aesthetically sensitive. You know, we've got a pretty classy downtown and across the community, but during this, you know, a lot of our small businesses have put signs up like we're open, takeout, and we've wanted to do anything that we can do to draw attention to them. We also have our Industrial Authority Board. We have a loan program that will actually guarantee loans that people are able to get. We're reassessing, are there some monies that we can release through that program as well. We're somewhat designated or somewhat bound to that, to not just do relief, but to advance companies that are their program to advance business in Chandler. So it won't, again, pay for payroll loss or other types of things. So I guess in summary, a lot of what we've done has been in education and trying to connect the dots with people, in relaxing sign, in using our IDA to advance some co-loan type things or anything else. We do a lot of phone calls, we do a lot of other types of things, that anything we can do to help at this point.
Many families in the city of Chandler are struggling. They are not able to pay their bills, they can't pay their utilities, and some even have food insecurity. What is Chandler doing to address that?
Well, recently we just received a parcel of money, probably $900,000 related to community funding. And this will add to what we currently have. So we've looked at that money for some food funding, as well as the majority of that will also be for rent and other types of programs that will help those who are at the edge of being homeless, as well as those who are homeless. So we've addressed that with those kind of monies. We also have within Chandler some general fund dollars that we will look to help with food programs, whether it's food banks to help them or different food dispersal programs. The United Food Bank and others have gotten some large grants from federally, as well as some relief from across the border with some produce type programs. So there actually is, in some areas, there's a fair amount of foods that you normally wouldn't think that is available. For example, I heard recently that they've been freshly stocked with a lot of milk that normally would have been dumped out. There are some other food bank programs that people are utilizing to give to food banks that normally they perhaps would not, and these might end up going to the dump or to other types of programs. We have seen a rise of a number of smaller food box giveaways or food program giveaways that seem to be doing well, and people are uncertain of what's available, and they want to make sure that they can supply for themselves and their families.
Doug Ducey stepping up, implementing statewide measures to help grocery store employees and food banks, deploying Arizona's National Guard to help restock shelves. Ducey also stopping all elective surgeries to free up doctors and other medical resources, and ordering bars and restaurants in counties with confirmed cases to close.
My name is Mark Stewart. I'm a Chandler City Council member. I've lived in Chandler for almost 20 years. My wife and 2 children, we moved here, and we absolutely love it.
Can you tell me some of the ways that the Chandler City Council has worked together as a team during this time?
Sure. I think that is exactly, the answers in the question. We've worked together as a team. I think it's important for mayor and council to move in lockstep with one another and be on the same page. We've met a lot during this crisis to make sure that we're, one, providing feedback from the community, business, residents, whatever that may be, and then try to make decisions based on what is best with the information that we have. But we've worked as a team from day one.
Has the Chandler mayor and the city council strictly followed Governor Ducey's orders, or have you kind of worked to develop your own sense of what's best for Chandler?
That question is a difficult question to answer, but I'll try to tackle it.
You said something about a misdemeanor. Do you think it will ever result in a fine?
Well, it's a Class 1 misdemeanor. It can result in the fine. You shouldn't be gathering in groups of larger than 10. That's the directive from Washington, D.C. I would go further than that. You shouldn't be gathering in any group.
Cities are like corporations, if you will. They serve at the leisure of the state, meaning by our Constitution, we have to follow the state direction. Now, there are chartered cities, there are towns that are not chartered, and for the most part, they're autonomous in the way they provide services. And so when you think of government, municipalities are not governing bodies. They're not supposed to be creating laws. That's handled at the legislature. So when the governor issues an executive order, whether or not we believe that it is constitutional or not, the cities have to follow it. So we work within those guidelines. There were some things that were not covered in the governor's executive order that we're responsible for. And so we did try to use data from our fire department and from the Arizona Health Department and from the Maricopa Health Department to do the safest thing for our community, and also be mindful that we still need to provide services. It was a very fluid process. There was no roadmap for this. We didn't have a game plan. We just kind of took the information that we had. We tried to work within the executive order. And the other caveat to that is that our staff is phenomenal at the City of Chandler. We're lucky. They get the idea of they're here to provide a service to the community, provide data, and they worked with mayor and council to give us the best information that they could so we could serve our community the best.
Bring in Dr. John Torres right now to help us separate fact from fear.
State lawmakers and the governor taking steps to combat the crisis.
It was another roller coaster day on Wall Street. Today was the dip part. Coronavirus uncertainty sending the Dow plunging.
My name is Sean Duggan, and I'm the Chief of Police here in Chandler. And I've been the chief now for just over 6 years. And before that, I was an assistant chief with the Scottsdale Police Department, where I worked for just over 27 years.
Realistically, how much time did you have as the police chief to get ready for the COVID-19 onslaught? And what did that look like for you?
Well, we actually had, we did have some time because when this started to play out as serious as it is, it affected other communities first. So we were able to learn some lessons from Kirkland, Washington.
It is not rhetorical or hyperbolic when I say that everyone needs to change their behavior, change the way we live temporarily, if we are going to prevent significant loss of life for the people we love in the state of Washington.
So give us a little time to take our plans and to ensure that they were up to date. We looked at our continuity of operation plan. So the goal was to ensure that we're providing essential services to the community while making sure that we keep our people safe. So we had a number of plans that we put in place to prepare if we needed to kind of contract the department, where we would roll in detectives and school resource officers and folks that support patrol to bring them back into uniform to ensure that we had contingencies in place, that we were able to provide that core service. When someone calls 911, a police officer responds.
I understand that last month, 3 Chandler police officers were shot during altercations with a convicted felon who was on the loose at the time. Has the Chandler Police Department seen an increase in violent crimes?
So fortunately, those officers are doing very well. 2 were wearing their, well, all were wearing their protective armor, and in 2 cases, that armor was able to help save our officers. So we're very blessed and fortunate about that. But overall crime in general has, in some categories, it's decreased. In other categories, it's increased, and I'll explain that in a second. But our calls for service, the amount of times people call the police for assistance, we've seen a consistent decrease over the last almost 2 months now, at times up to 25%. So we attribute that to people staying home. There are less people on the street, and there are a lot less vehicles on the street. But we've seen a decrease in collisions. We've seen a decrease in residential burglaries. Most people are home. We've also seen an uptick in domestic violence and auto thefts and burglary from vehicles. So cars left out on the street there seems to be more cars out on the street and more opportunity for some criminals. So the question is, overall, we've seen a steady decrease overall, but in some categories, we've seen some upticks.
More and more people are wearing face masks, including criminals, to better conceal their identities. And a good example is a sexual assault suspect about whom you recently posted a silent witness bulletin. Do you see those face masks as a potential hindrance to law enforcement efforts in terms of identifying the perpetrators?
Well, there could be a potential that may be the case. But again, getting back to why we're wearing the mask, there's a health and safety issue as well. So we're trying to strike that balance. And there's different technologies that we can use that maybe assist us. But certainly the health and safety is paramount, and people are encouraged to wear the mask when they're out in public. But to answer your question specifically, there could be cases like the one you decided where that may be problematic.
From the governor's briefing today, testing and when will the state reopen?
Issue citywide guidelines last week.
We are afraid for our patients.
With doctors still fighting to find medical grade N95 masks.
These measures will be disruptive to day-to-day life, but there is no need to panic.
My name is Christine Talandier Desjardins Ellis. I am currently a registered nurse. I have a Bachelor in Science in Nursing. I live here in Chandler, Arizona, and I'm married and I have 2 children.
What is your background and experience as a registered nurse and within the medical field?
Actually, I started nursing since I was 5 years old. I've been loving nursing ever since. I've worked into the field from being an LPN, from being an RN, and even being a director of nursing. And I used to be also an owner of assisted living, so my background is very vast when it comes to nursing.
What have been one or more of your biggest frustrations?
Miscommunication.
It turns out that misinformation and conspiracy theories about COVID-19 are rapidly spreading online, creating what public health officials around the world are now calling an infodemic.
Because by the time the head get the information to pass it down, and then to pass it down, it's already obsolete. We have to start all over again. So it is very important that accurate information is passing on to the head, and so the head can pass it down, and so the people at the bottom can have a chance to implement what they need to do.
That Arizona is headed toward a public health crisis unless something is done now to slow the spread of COVID-19.
Yeah, this comes as the number of coronavirus cases have jumped.
University of Arizona professor showing hospitals will reach full bed capacity. The impact of the coronavirus also putting a strain on healthcare workers and patients.
My name is Tom Dwiggins. I'm the fire chief for the city of Chandler. I've been with the city of Chandler for 22 years now, and I live in South Chandler.
From your perspective, what have you seen as COVID-19's impact?
Well, from my perspective as the fire chief, I've actually seen 2 different impacts. Obviously the health impact that we have within our community, and then the economic impact. And really my job as the fire chief is to focus on the health impact. Our firefighters are all paramedics and EMTs, and so we are the front line. We are the ones that are responding on 911 calls every day. We're going to people's homes that are actively positive with COVID-19. We're treating them, we're transporting them to the hospital. So we're seeing it. We're seeing the people that are sick in their homes. We're seeing the nursing homes. There's a big outbreak in the nursing homes in the city of Chandler, and it's our firefighters that are going in there and treating these patients. And so working with the Maricopa Public Health, we're working with the Arizona Department of Health Services, we're working with the CDC, we are working with our residents to try to bring them the latest guidelines. We're working with the hospital systems, and so it's really been a big change since March. We were altering our protocols. We were changing the way that we treat patients. We were changing the way that we wore our uniforms. We were, trying to, like everyone else in this country, trying to find PPE so we could protect our firefighters. Obviously, just a dramatic shift in pretty much all facets of how we run our operations. From when we walk into the station to, what we do when we actually get home from work, where many of our firefighters are strip down, go right to the shower, put their clothes in the washing machine, and so we've seen a pretty big impact in the city.
These times are truly unprecedented. Has there been a particular source or 2 of frustration?
Well, I would say yes. Obviously, the data that's changing almost daily. As everyone knows, depending on which website you go to, there's a different projection of when the peak will be here, when the peak will be gone. how many resources we'll need to utilize. And it has been frustrating because we try to make our decisions, especially in emergency management, based on real-time data, accurate data. And when you have a data source that changes every week, it's very difficult to do. The data of the number of cases, the number of deaths, the way that this virus is transmitted really impacts our response. And it changes the way that we respond to it. It changes the way we wear our PPE, the way we analyze what our burn rate or how much PPE we use per day is, what our expectation should be of when Arizona, and Chandler specifically, is going to see its greatest need for resources. I can tell you that part of the fire department's function in the city of Chandler is to run the Emergency Operations Center. And so myself and my staff, we have been tasked with not only looking at the operations of the fire department, but the entire city. And so you want to have good information. And we created the first coronavirus pandemic plan. Every morning at 9 a.m., I get the latest data from Arizona Department of Health Services. And almost every day, the data set is put out with an asterisk. And the asterisk is, the data changed because XYZ occurred. And so it's a little frustrating, but that's what we do in the fire department. It would be nice in the future, and I think I'm speaking on behalf of every fire chief in the country, maybe the world, is that we get accurate information. With that said, it's a novel virus, and the word novel is new, which means they're still learning information about it every single day. And so we've also learned that, hey, this is part of a pandemic, is that you're not going to have this clear path. And I hope a takeaway from this pandemic, from the coronavirus, is that we probably need to really invest in one source of data so you don't have all these conflicting reports. Because as data conflicts with other data, you get to a point where you don't trust anything. And that's probably the safe bet at this point, is just not to trust anything you see, but then you're in the blind. And it's hard to lead an entire city of 264,000 people in the blind, especially when we're talking about the health of the city. And so we would just prefer clear, clean data.
It's important not to forget about our mental health. With all the changes happening as we overcome this pandemic, it's easy to feel overwhelmed, anxious, and stressed.
Mental health experts say we can't lose sight of an equally alarming issue: the long-term mental health impact the pandemic is going to leave on society.
My name is Ted Huntington, and I currently reside here in Chandler. We've had a home here for over 20 years, and I have a few different, jobs, activities, things that I'm involved in here in Chandler, the community, and around the state, and then some that even go worldwide in some of the ministry.
When you started hearing that a pandemic was going to be happening right here in Arizona, what did you do to get yourself ready personally and professionally?
Well, and that's an interesting question, and that kind of a twofold, as you said, because there's personally and then there's professionally. And when this was really becoming evident, you see, you started to get the sense of this is going to be a challenge, and it's going to be a great challenge. And then when you started to see the effect that it was having, not only locally, but globally, this is such an opportunity to really focus on hope. And the things that we do now really have to really bear fruit. Then, this is a right now moment where we've got to really instill, a lot of positivity, a lot of hope. From a personal side, I embraced it as an amazing opportunity for individuals to really see love in action.
One of the many things that you do is that you work with youth that are struggling with substance abuse. How have you seen that situation change during this time of pandemic?
Our hospitals will say that there is an increase in depression, anxiety, and individuals that have come in dealing with substance-related issues. History, for one, that history will tell us that anytime there is a pandemic type situation, like a hurricane, like a bombing of 9/11, or anytime there is something where control is taken out of your hands, and then you have an unknown, then the natural process of the mind, especially a youth that's not used to dealing and coping with life-changing experiences, history will tell us that they will revert to coping in other ways. Wall, so to speak, the shield of this, I'm doing everything by video, and I can't even really feel somebody's emotions, really? I mean, unless you have a relationship already built, it's really hard if we think about it. That opportunity to open up to you so that you really know what they're doing and really what's going on, and not just masking or hiding or fear or something else keeping them from being honest with you. While they're working or they're coping with these mechanisms. So I think that we have to look at a totality.
The critical medical procedures delayed by the virus, like cancer surgeries and transplants, when will they be able to resume? Hospitals have also taken a hit as the pandemic forced them to cancel elective procedures, including cancer surgeries.
Lawmakers and advocacy groups have been warning that the funding could run out.
Frank Lloyds with Desert Car Care off of Chandler and Dobson, run an automotive service center. Been there about 15 years, active in the community, and grateful to be here.
Did you actually apply for a PPP loan for your business? What was that process like for you?
It was a nightmare. I mean, the good intention of the government in trying to help small business, if you go back to 2008 or even September 11th, I thought that was phenomenal. But the mechanism and the means of getting that information from tax information and stuff, that was very difficult. I personally had a difficult time uploading information. It wasn't a plug and play scenario. So it took a long time, not complaining, but it ultimately now is in limbo. I have not qualified, which it is what it is. I think one thing about business is you figured your way out. You figure ways to get through it. And so between what I can do, between fixed expenses and variable expenses, we're going to manage a way. I'm very grateful to have my core team. I will do anything to keep them not getting paid for me. I've done it before to keep folks employed and keep our business moving forward. If I have to do that, we'll do that.
I understand you had a serious health crisis yourself just a few months ago. Can you talk a little bit about that and how that may have been different had you been dealing with it maybe even 1 month later?
For sure. I mean, it seemed like it come out of nowhere. But I had a virus. And in fact, I had infectious disease control. And they said, you've got COVID. But they actually tested me for that. There was medication. They put me on the medication. I had a high fever. I couldn't breathe. It was really bad. And so during the course of all that, the blood work revealed that I had heart issues. And within 4 days, I had a quintuple heart bypass. But I had 2 100% clogged arteries. Third was 90, fourth was 60, and the fifth, you're not even born with 5. The fifth little guy was also messed up. So, but that's what happened. And I wonder, in my case, I look at this whole COVID scenario, it almost seems like I may have been a benefit to that. If I hadn't gotten a virus or I hadn't gotten, sick at the right time, because all the elective surgeries were all put on hold, could I have been on a waiting list months later to get that needed heart procedure? So very grateful, it's a hand of God, and I was very lucky.
As the number of cases grows, there's a new warning tonight. The U.S. does not have enough coronavirus test kits to meet the current demand.
My name is Tina Marley, and I actually recently have gotten into motivational speaking.
At what point did you actually start to think, hey, I might actually have coronavirus? When did that happen for you?
Could I just be coming down with something? I hadn't gotten sick for a really long time. So I wasn't sure, but you really don't know what to think at first, and there was so much going on. I called my doctor right away.
How quickly were you able to get a coronavirus test, and did you get that through your primary physician?
It wasn't that easy to get tested. I woke up, I think it was a Monday or Tuesday, feeling ill, called my doctor immediately, and they said, do not come into the hospital unless your lips are turning blue, I didn't get tested that day.
The president says more are on the way, but it will take time.
We don't have enough tests today to meet what we anticipate will be the demand going forward.
A few days later, I called a different hospital. I'm just concerned if this is it. I haven't been feeling well. I'd like to come in and get tested. And she said, you know what, we're gonna bring you in the back, we'll get you tested. You know, kind of arranged time to get in, took me right back. And she said, normally we're not supposed to test anyone until unless they're very ill, and you don't seem that ill, but we're gonna go ahead and test you anyway. I found out 2 days later that it was positive. He said to stay on the antibiotics that I was on. He said to stay on that, finish out the Tamiflu, and to take a Z-Pack as well. He said, just cover your bases. And so I did.
Tonight, the U.S. is closed to most foreigners who've traveled recently to China.
The coronavirus crisis now perhaps triggering even tighter travel restrictions on top of what's already in place.
My name is Cade Askey.
And Cade, can you tell us where you were and what you were doing when the worldwide pandemic broke out?
I was in Bohol, Philippines, serving as a missionary for the Church of Jesus Christ of Latter-day Saints.
Were there travel restrictions?
There were, but I would say they were more so of guidelines other than restrictions.
And what happened when the travel restrictions began?
The government of the Philippines, they gave us a notice of when all the foreigners had to leave the country, and they also were a big help in providing a way for all of us to get out of the country as well.
Did you have to quarantine when you got back to the United States?
I did. I had to quarantine myself for 2 weeks once arriving in the state, and I got bored pretty quick. However, I understood why and the reasons behind having this isolation, and I saw that it was the benefit for others, and so that's how I got through it, was realizing how I could help other people by self-isolating myself.
Do you feel comfortable with the direction the world is going right now?
Yeah, I'd say I'm comfortable with it, because there's always be challenges in life in general, and I guess that's something we all signed up for. And so after the pandemic and after whatever comes next, I'm sure that people as a whole can pull through it.
Arizona schools statewide will be closed.
Well, it's graduation time for seniors out at Chandler High School.
But obviously, because of COVID-19, things are looking a lot different.
Hi, my name is Miranda Fimbres. I'm a Chandler High 2020 graduate. I'm the first in my family to graduate high school and the first to enter college.
How did the teachers at Chandler High School work to keep you engaged with your classes and keep you involved in what was going on with school?
My teachers have done a really good job on making sure that they're still staying connected with us. Specifically my English teacher, Mrs. Jones. She's created YouTube videos to just kind of give us updates. She makes sure to text us. We've been using Google Classroom a lot, which has helped us. With my dance classes that I take, I know it's not a part of my high school, but my dance teacher, Gloria, she's also been doing a good job to make sure that we're still practicing, so we've been using Zoom. So we're like practicing in our rooms. So that's another example of how a teacher has been getting us through it.
When you found out that you were not going to be having a traditional graduation ceremony for your senior year, how did that impact you?
It impacted me a lot because as a first generation student, I really wanted to make my parents happy and, have them get the opportunity to see me walk across the stage. Of course, other family members have graduated, but for me it was different because I'm the only girl. And everyone's bent over backwards to make sure I could get to the point to graduate. And now that they're gonna have to probably see it online, it definitely hurt it a lot. I'm still fingers crossed that something else can happen, that they can somehow see me. It's kind of unique that they'll probably see me on stage through the camera.
What are your plans after graduation?
Well, hopefully I could go to college on campus, not through the screen, but yeah, I'm planning to go to Chandler Gilbert Community College, and there I want to study business. It's between that or art. and then hopefully transfer to an out-of-state university.
Reopening Arizona in the midst of the coronavirus pandemic.
We are all adjusting to this new way of living, working from home for many of us, school at home for the kids, ordering takeout instead of dining in.
Check out this fancy mural and this sweet message of support.
Now, you have a family with children. How are you coping?
Well, I have 2 little elementary school age boys, and so we're very blessed. We have a nice backyard that they can run around in and get exercise, but they've been at home since the schools closed and they have not left the house and they miss their friends so much. But again, technology, I guess, is the silver lining of this pandemic. They get on Zoom calls with their classmates, they do Facebook Messenger with their friends, and we actually went to kind of old-fashioned. We're doing pen pals through the mail. So we're all coping as best we can and just trying to change it up and do shelter in place and follow the governor's orders.
Many Americans are sacrificing their personal freedoms for the common good.
There have been times across history where the government has quickly turned to health as being its wedge issues in order to carry out what would otherwise be a political agenda.
How do you deal with an invisible enemy without having to sacrifice people's liberties and freedoms?
That's a tough look. I've been on the forefront.
Pinal County Sheriff Mark Lamb says he won't enforce the penalties, saying the governor's order conflicts with the Constitution.
Keeping people from going out and working and being able to live their lives like they normally do, I think you could make a clear claim that that's a constitutional violation. You also have the First Amendment where you have the right to peaceably assemble.
I feel like that in many cases we have overstepped those liberties and we have violated some constitutional rights, and I'm very disappointed to see that across this country. I'm disappointed that a lot of Americans have let fear overtake their appreciation and value of freedom. Mostly speaking about Arizona. Hospitals are furloughing. They weren't overrun. And we saw that there never truly was a curve. If anything, it went down. It stayed pretty steady. Yet, we still moved the goalpost.
This order's been in effect for 30 days. And I know it's been a long 30 days for all of us. Most of all, those that are the small business owners and the medium-sized business owners and their employees, people that have lost their jobs or had a reduction in pay. It's 15 more days. I'm asking for some patience.
And so I think that begins to infringe on people's rights. You also have government picking and choosing which businesses are essential. I would make an argument that everybody's life, everybody's liberty, and everybody's pursuit of happiness is essential. I think we got away from what America is, which is personal responsibility. Liberty and freedom is a beautiful thing. It allows us to succeed, but it also allows us to destroy ourselves. You have to find that balance in there during these difficult times. But you've got to always practice with freedom, personal responsibility. I wish the governments would have encouraged more personal responsibility instead of instilling more fear. I think the media instilled a lot of fear and panic into people, and it's caused this to be a bigger issue than what the numbers say it is. If you just look at the numbers, which we have to question as to whether or not they've been pumped up a little bit, if you just look at the numbers, you have to say that the reaction was above and beyond. But if that's what it took to save lives, then great. If you are afraid and if you're concerned, then I highly encourage you to continue to go out and practice social distancing. Continue to follow the CDC guidelines. Wear a mask, stay at home until you are comfortable to come out. But we have to get back to what we're doing, because if we don't, we won't have anything to go back to.
As we all work through this difficult time, it is so important to see the good.
There's a lot of kindness and people helping people when you really look for it.
You know, all over the valley, we are seeing so many stories of people who are stepping up to help neighbors in need.
Do you think that Chandler is going to emerge out of this pandemic situation that we're in as a stronger and wiser city?
I do believe that Chandler we have positioned ourselves to rise out of this very well, to make sure that in terms of what are we shutting down and what are we not shutting down. Other cities have been honestly quite onerous in terms of overreacting, in my opinion anyway, to this, because again, you can delay people who are going to get sick, perhaps getting sick, but you can't prevent this because, again, we're addressing the impact of this virus for over a year. So unless people or companies are prepared to stay shuttered for that long, we're delaying in order to make sure that medical care is available. So we've done that well, I've thought. And as a city, we've been the first one to not just have an emergency operation plan that we put into a place. We've put together a plan as a city to reopen Chandler a couple weeks ago, and we've enacted that. So we are reopening our sports fields, for example. We have a plan to reopen our pools. We have a plan to redo these other things. And I think as a city, companies are also noticing. And although we've been heavy hit as a city, financially impacted, we're also had our house in order before this hit. So we had adequate surplus or what I say funds for rainy day, for an economic downturn, for money that we could shift and move nimbly to be able to address these types of concerns. But we'll figure this out. It's what Chandler does, and we're doing it well.
Too many restrictions on civil liberties, and it could be up to individuals and the courts to keep the government in check.
That it's not unpatriotic to hold our government accountable.
A hard line to walk between enforcing public health measures and preserving the rights and freedoms of citizens.
Well, our job is to keep the community safe, and one way we do that is to enforce laws. But certainly the best practice would be to gain compliance, because this is new for everyone. So we spent a lot of time communicating, educating. As of today, we're almost 2 months into it. We have not made one single arrest for any type of COVID-related violation. And that's a testament to the community and our officers working together.
Thanking the real heroes in all this, the healthcare workers on the front lines of this pandemic, working in all kinds of difficult conditions.
Neighborhood streets turned into an artist's canvas. Arizonans continue to rise up and show the world we're staying strong in Arizona.
Have you found that members of the general public are coming to you for moral or emotional support?
I believe the general public is coming to us for support in the form of bringing us cookies and cake and things like that. I'm really concerned about our fitness level once this virus is passed, because the community has really rallied around public safety and frontline workers in general. I think that this is a horrible thing that's happening, and there are people that are dying, and that's sad. And we certainly don't want to be in this pandemic. But there's a lot of positive things that are happening as well. And we're starting to identify, and I'm not talking about the police and the fire department, but I'm talking about blue-collar workers that we need. And we're just figuring the word essential has been expanded. I really love seeing the community rally around teachers, the community rally around nurses, even grocery store workers. I think that's a great thing. And so, as far as moral support goes, I wouldn't say that they're necessarily coming to us. We've closed down all the fire stations, so they really can't. But I think that the things that they're doing to support us is really about maybe supporting themselves, right? Is trying to find the good in such a bad thing. And so if that means, they bring us cookies and cake, we'll take it. I haven't heard of any complaints. And we saw this actually during 9/11. I was a firefighter in Chandler, and it was really the same thing. The way that, there's been so much attention on negative stuff, but the way that our communities, across the country come together is really the story here, is, the positive things that are happening.
As a longtime Chandler resident with 2 kids, how have you worked to keep your family in a positive emotional space?
Oh boy. So, I have a 19-year-old and an 18-year-old that obviously are on social media quite a bit. I have a wonderful wife, and she and I are on social media quite a bit as well. And I think this was a social media-driven phenomenon. As much as it was a health crisis, the fear that was stoked early on came directly from social media. If I want to point my finger at something, I think it was that. We weren't able to decipher the data that we had effectively. Internally within the Stewart household, communicating the facts that I had, the same that we've tried to do in Chandler, was the key to this. We didn't take leaps. We didn't make conjecture or anything like that with the data that we had. We just said, okay, right now, like if I work through the plan, early on, we were quarantining ourselves. We didn't know. I've got a daughter with asthma, and I've got asthma. So we were like, all right, let's lock it down. Let's start playing, putting together puzzles and playing games and things like that. So positively, we're using these new cards at dinner that are conversation starters. This is something we didn't do for 18 years, and now we're doing it, and it's something we're doing every night. So that's a positive thing that came from this, that we're connecting at the dinner table like we've never have before, and the phones go away. And I think the other thing that my kids realize from all of this is that you got to go do your own homework. You got to research things. And so there's a positive that came of that as well, because early on, we were getting inundated with bad data, and bad data in, bad data out. And now we're getting better data. And in my household, it matters. And I think, in reflection, it was bad, but it was good. We got closer together as a family, and I'm hoping that happened for a lot of Arizonans.
As we celebrate the encouraging triumphs over coronavirus, hospitals are reaching major milestones with patients recovering and then released into the arms of their loved ones.
Nurses and doctors clapping for a patient who was able to walk out of the hospital.
In your medical opinion, how do you see our community working together to aggressively flatten the curve of this COVID-19 virus?
By caring for each other. I've seen this community rise up. People are looking out for each other. For example, this organization that I'm with is a doctor out of his own heart. He is putting money out, getting people involved to do all those testing. We are really in collaboration with other big organizations all over the US to make this happen. So it's from people's heart. When people care, they do come up with solutions to get things done.